This is quite a useful section. It just goes over the principles of health and well-being, how we might promote that to our clients. It's ultimately one of the major reasons why we might do training. By the end of the session, you should be able to define what we mean by health and well-being. You should be able to recognise the factors that affect health and well-being, including lifestyle choices. You should be able to understand the role of activity and exercise in maintaining health and well-being, and then do what we call the fit variables: frequency, intensity, time and type, to prescribe the right amount of activity for your clients. And when I say prescribe, we tend to have conversations with them now and decide how they might go, but whether you vary the frequency, the intensity, time and type of activity will affect the type of fitness they develop. So firstly, before you crack on, just pause this, see if you can define health, if you can find well-being. You might also want to consider what fitness is and see if there's any overlap between those. So just pause this and have a think. So here's some definitions. Health is the complete state of physical, mental and social well-being, not merely the absence of disease or infirmity. So this is a World Health Organization definition. You see it's quite long-standing, but it does widen it. It's not just not having a disease, so being in a good physical state, being a good mental state. There's been a lot of focus on that in the last few years, and people are increasingly understanding the social importance of feeling valuable, feeling a part of society, not being isolated is important. So well-being is the state of being comfortable, healthy and happy. So you can see there is some overlap, but the well-being is a little bit looser term. Health is a more defined term. Sometimes we look at this and we call it total fitness. So total fitness, and we can then break down the components of that. So if we're looking at health and well-being or total fitness, it does have some different components. So as we meant, there's a mental and emotionally fit and strong, being medically fit, not being diseased, having good nutrients in your diet, being nutritionally fit, being socially fit, and being physically fit. So obviously as fitness professionals tend to focus here, but there's lots of opportunities to engage people in social things, to advise on nutrition, to give them some background to some of the medical conditions they might have. It's very important to remember we're not medical professionals, and to create an environment where they might be mentally and emotionally fit too. But our tool is the physical side. So you might want to pause this here, have a little think, see if you can define any of those more, see if you can think of any examples of times when you felt activities benefited you, how you might help your clients do the same. So here's some following definitions. In terms of physical fitness, the well-being of the body systems, including the heart, the lungs, the muscles, the bones and joints. So you see it covers quite a lot here. So it covers health-related and skill-related components. So what it's saying is if your heart and lungs are working well, you tend to ward off a lot of diseases, etc. If your muscles, bones and joints are working well, you tend to have physical comfort, have absence of pain, be in a good place. And not just being strong, you also have to be skillful. All right, so some of the skill-related components involve being fast, having good agility, having good reaction time, all part of physical fitness. Mental and emotional fitness defined as the well-being of the mind, a positive mental state and a harmony between the mind and emotions. It includes a person's ability to manage stress. Big issue at the moment. A lot of people feel a lot of stress. Stress is a normal part of life, but being able to cope with it well is a good skill, which is very helpful. You also want to try and be free from injury, chronic disease and illness. So that would be a medical fitness. Nutritional fitness is defined as having access to healthy food, eating a healthy diet, and with a balanced nutritional intake for fuel, growth and repair. So our job as a fitness professional here is to give basic advice, which is fairly broad. Our area of real expertise is on the physical side. And then social fitness is defined as having social healthy reactions with relationships with other people. There are opportunities to do that with our field. So see if you can remember the components and write them in here before you move on. And you can do this if you like. So each group, so think about the different areas, make a list of the factors that could affect that, and then have a chat with someone else. You can either put it on a group or make a little video. Okay, so and then you could talk about lifestyle choices. So basic lifestyle choices are things like diet, smoking, alcohol, and activity. All right, so think about how they may affect health and well-being. Other factors which we can talk about, so we can talk about controlled and non-controlled factors. Things you can't control is your genetics, your age, and your sex or gender to some degree. So these are things that are largely outside of your control. But these are things you can do stuff about. So you can do stuff about your activity levels, your diet, your smoking, and alcohol and drug consumption. There was a very big study called the EPIC study done a few years ago. So they encouraged participants to do 150 minutes a week, to eat 5 vegetables a day, to not smoke, and to drink within the guidelines. And they found they lived an average of 14 healthy years. So it's quite powerful and can make a big difference to your lifestyle. So these are things you can change very simply. The impact of the choices you make: if you make certain choices with your controllable factors, if you make positive choices, you can reduce the risk of all these conditions. You can improve your functional capacity, your quality of life, you tend to live longer, and improve your confidence, and generally happier at that point. You also tend to not be in medical facilities or need as much medical treatment later in life, which makes you feel a lot happier as part of this quality of life area. If you make poor lifestyle choices, you're much more likely to have coronary heart disease, mental health issues, diabetes, obesity, cancer, osteoporosis, chronic obstructive pulmonary disorder, and stroke, and actually lots of other diseases. So they can make a massive difference just making some positive lifestyle choices. One of the things you find with clients is they feel they have to be very, very, very fit. Actually, to improve your health, you don't. It is about minimal 150 minutes walking, eating some vegetables, not smoking, and limiting their drink. And actually make a massive difference. So it's also interesting to consider how much physical activity is necessary, so to improve your health and well-being, and then we can also think about improving your fitness. So have a think yourself before I give the answers. How often a week do you think you need to do some activity? How intense does that have to be? Does it have to be hard or easy? How long should it be for? And what type of activity is the best? Have a think about that before you go forward. So these are the recommendations for health, and you can see the recommendations for health are 150 minutes of moderate intensity a week. So it's not a lot, it's an average of half an hour on 5 days a week, which do not have to be done in one go. Okay, so it's a very normal target. You don't need to be wearing fancy fitness clothes or join a gym or do anything particularly apart from maybe increase your walking levels. If you prefer to spend less time, you can do 75 minutes of vigorous intense activities. So that might be 15 minutes on a number of days of the week, but a little bit faster. You can also do whatever equivalent combination of both. One of the things we're trying to promote now in fitness is to allow people to make their own choices, allow them to make the choice that fits their lifestyle, and not be too, apart from promoting movement, not be too draconian in how that's done. A minimum of 2 days a week of muscular strength and endurance training. So So this could be going to the gym, but it could be doing some bodyweight squats in your home. It could be walking uphill. It could be doing some cycling. So it doesn't always have to be very, very, very hard exercise. Move more often, sit down less. Very good advice of people. Particularly long periods of seated activity have been shown to damage health, even after about an hour and a half of sitting. So if you can keep people moving often through the day, it's healthier than doing one bout of hard exercise and then being sedentary the rest of the day. So have some descriptions of the intensity here. So light activity, little or no exertion, does not normally cause a notable change in breathing. So it could be a Sunday kind of stroll. Moderate activity is sustained rhythmic movement that leaves a person feeling warm and slightly out of breath. So this could be, it could be a jog here, but it could also be a more just a faster walk with a bit more purpose, which people do. So moderate activity doesn't have to be very, very hard. Vigorous activity, sustain large muscle movements, 60 to 70% of their maximal heart rate, make a person sweaty or out of breath. Okay, so remember we said we'd want either 150 minutes moderate or 75 minutes vigorous. A lot of people are scared and they're worried about the vigorous part. To promote health, they really don't need to do that. Moderate activity is perfectly fine. And even light activity makes a massive difference to health. So you should now be able to define the components of health and well-being. You should be able to recognise factors that affect health and well-being, including lifestyle choices. You should be able to identify the role of activity and exercise in maintaining and managing health and well-being, and talk about frequency, intensity, time and type to recommend activity to your clients. Try doing some Kahoots and testing yourself. Think about the types of principles in training. There will be some good YouTube clips on principles of training and fitness. Ask each other questions and embrace the challenge.